Growing up, as a child, I had an accident. I was fortunate to come from a family of doctors, so I was able to receive the necessary care that I needed. But then when I became a doctor myself, I saw the contrast that not everybody was as fortunate as I was. And it's that contrast that made me want to start UltraTeb. I'm Dr. Mohammed. I'm CEO and co-founder of UltraTeb. UltraTeb is a fintech B2B e-commerce platform for medical supplies. We help hospitals procure medical supplies directly from manufacturers, eliminating intermediaries and reducing costs by around 20%. We also provide financing to hospitals using our embedded finance technology.
So we are here?
Yeah.
This way?
As a doctor, I knew that no matter how much I worked, my impact will only be as significant as what I'm doing with my actual hands. I came here and realized that it's not just an accelerator program. I feel like I'm part of the Accelerate Africa family. These people helped me not just with technical knowledge, but actually through their vast network that actually helped me accelerate a lot in UltraTeb.
Ladies and gentlemen, Dr. Mohammed.
Hello? Can you guys hear me? Okay, perfect. Hello everybody, I am Dr. Mohammed. I'm co-founder and CEO of UltraTeb. UltraTeb was born as a family startup. We come from a long line of doctors. My grandfather, my father, my mother. I co-founded UltraTeb with Dr. Yasmin, my sister, who's a medical doctor with expertise in hospital management, Dr. Mohammed, a pharmacist with a decade's experience in healthcare supply chain. Myself, I'm a serial entrepreneur in love with technology. But I too at some point was a medical doctor. In that time, I saw countless families helplessly waiting because hospitals struggled to secure the necessary medical supplies to treat their loved ones. This stems out of the deep inefficiencies in the healthcare supply chain in Africa, starting one with the multiple intermediaries that increase costs by 50% in a continent where people can barely afford to cover healthcare. 2, hospitals have limited cash flow, so they cannot stock up on everything they need. And lastly, the unpredictable supply chain in Africa, poor inventory management, always leading to stockouts. This is where UltraTeb comes in. We are a B2B e-commerce platform that connects manufacturers directly to hospitals, eliminating the entire intermediary chains and reducing costs by 20%. We also partner up with banks to provide hospitals with an embedded finance solution, enabling them to buy everything they need and pay later. And lastly, we use all this data to predict stockouts before they even happen. The hospital procurement market in Africa and Middle East alone is more than 100 billion US dollars. Medical consumables counts 21 billion US dollars. Our business model is simple. We take 12% on everything sold through our e-commerce and 2 to 4% on the financing. We started UltraTeb at the end of 2022. We just had 17,000 US dollars in sales. Today, with more than 330,000 US dollars in cumulative sales, serving more than 50 hospitals, but most importantly, reducing costs by 20% and impacting the lives of more than 100,000 patients. Our vision for UltraTeb is clear: to do our part in bringing affordable and accessible healthcare to Africa. Thank you.